Welcome to our fourth series on SCI educational series, Enhancing Patient Safety. Today's presentation reaffirms our collective efforts in performing vital screenings, suicide risk, substance use, and influenza within 24 hours of admission. While these screenings are already part of our workflow, this session aims to unify and strengthen our approach. I'm Michael J. Orellano, your SCI nurse educator. Our SCI population is medically vulnerable, and early assessment is critical in preventing avoidable crises. Together, let's discuss why our actions within the first 24 hours can have life-saving consequences. By staying consistent, we reinforce a culture of safety and excellence that defines SCI nursing practice at the VA. Here's our learning objectives today. This presentation will help reinforce three key objectives. First, it emphasizes the clinical rationale behind timely screenings, why they matter so much in SCI settings. Second, it highlights the potential consequences if these screenings are delayed or missed. Third, it provides a clear, consistent framework for how to embed these practices more deeply into daily admission routines. By aligning our efforts with best practices and national safety goals, we strengthen our standards and reduce risks. Let's not just do it, let's do it right. Every time, for every patient. Understanding and assessing suicide risk. SCI patients often navigate complex psychosocial stressors, loss of function, isolation, and identity changes that heighten suicide risk. Studies indicate suicide ideation is more prevalent in this group, particularly during care transitions. Conducting screenings within 24 hours provides a vital window to detect psychological distress and activate immediate support. Nurses are often the first trusted voices patients engage with, making our vigilance indispensable. The VA emphasizes suicide screening as a top safety goal. This is not just documentation, it's a compassionate intervention that could save a life. A quick check for substance use. Many SCI patients rely on substances for self-medication, often unreported unless we ask directly. Unrecognized substance use can result in dangerous medication interactions, unmanaged withdrawal, or behavioral issues during rehab. Within the first 24 hours, we must ask the right questions to identify these risks and refer to the appropriate services. Our role in this is critical. We observe signs others miss and hear disclosures others don't. Early screening informs safe pain management plans and promotes recovery. This isn't about judgment, it's about proactive, trauma-informed care that safeguards both patients and staff. For influenza check and prevention. Flu screening may seem routine, but for SCI patients it is urgent. Their impaired respiratory capacity means even mild influenza can escalate into life-threatening pneumonia. Early detection, especially within 24 hours, allows us to implement swift infection control measures, masks, testing, and isolation. Delays increase exposure risk across our unit. The CDC highlights early flu screening as essential in communal care settings. As bedside nurses, we are the first responders. This is about protecting our patients, ourselves, and our extended SCI community from preventable outbreaks that disrupt care and compromise safety. Clinical impact of your timely screening. Neglecting admission screenings can result in avoidable emergencies, delirium from withdrawal, unrecognized suicidal thoughts, or respiratory failure from undiagnosed flu. SCI patients are medically fragile. Deterioration happens quickly without prompt intervention. The Joint Commission and VA mandate timely assessments as foundational to patient safety. Consistent screening within 24 hours isn't just policy, it's smart nursing. It helps prevent crisis escalations, reduces readmissions, and ensures coordinated care across disciplines. When performed consistently, these screenings become the first step in a safer, more responsive clinical journey for every admitted veteran. Your every screening counts. Let's pause and recognize how meaningful each screening truly is. That quick assessment at admission, it might be the only opportunity to catch suicidal thoughts, risky substance use, or early flu symptoms before complications develop. What may seem routine to us is transformative for the patient. These screenings create a ripple effect. Every nurse who acts consistently strengthens the unit's safety culture. The difference you make may not always be visible immediately, but trust that your commitment changes lives. Let's continue being that critical link. Our daily actions build trust, prevent harm, and reflect the very best of SCI nursing. Risks of missed screenings. Now let's talk about what happens when screenings are missed. Unfortunately, we've all seen the aftermath. Patients in crisis from undetected substance use, respiratory decline due to unrecognized flu, or mental health emergencies that could have been prevented. These events not only harm the patient, but increase workload and emotional stress for the entire team. Inconsistencies disrupt care planning and patient confidence. We don't just owe it to the policy, we owe it to each other to stay aligned. One missed screening can undo days of progress. Let's commit to never letting that opportunity slip by again. Embedding these screening into our nursing culture. Incorporating 24-hour screening into our nursing culture showcases our commitment to excellence and veteran-centered care. These practices foster patient trust. They see that we are observant, responsive, and ready to act from the moment of admission. An early nurse-led assessment set the tone for the entire care plan. Proactive screenings prevent avoidable events and strengthen interdisciplinary coordination. SCI nurses lead by example. By embedding safety protocols into our daily rhythm, we become clinical role models. Let's treat this as a professional standard, not an optional step, and inspire consistency across shifts and teams. Wrapping up. To conclude, timely screening is more than a regulatory task. It's a cornerstone of SCI nursing practice. Screening for suicide, substance use, and flu within 24 hours of admission enhances patient safety, ensures early interventions, and improves overall outcomes. Each nurse contributes to this safety net through vigilance, empathy, and consistency. This presentation reinforces that we already have the tools and knowledge, we just need to use them systematically. Let's commit to making this part of our admission culture, ensuring every patient receives the proactive, high-quality care they deserve. Together, we elevate standards and save lives. References. The following scholarly sources, published between 2020 and 2025, are formatted according to APA 7th edition guidelines and serve as the evidence-based foundation of this academic work. Utilizing current peer-reviewed literature ensures credibility, supports informed decision-making, and aligns with doctoral-level standards for scholarly rigor, relevance, and professional integrity. Thank you, team, for your unwavering dedication to our veterans and to each other. SCI nursing is both a challenge and a privilege, and your commitment to patient safety through consistent screenings reflects the highest standards of care. Every action you take within those first 24 hours matters deeply. Continue to lead with compassion, professionalism, and purpose. The impact of your vigilance echoes far beyond each admission. Together, we make a difference. One screening, one patient, one day at a time. Please stay tuned for the next installment of the SCI Enhancing Patient Safety Educational Series, scheduled for next Wednesday. For any questions, please call me at phone 214-857-2787 or my extension number 72787. You can also email me at michael.arellano@via.gov. I am looking forward to your continued participation and wishing you a productive and rewarding day ahead. Again, thank you very much.